For help with prolonged aches and pains, ask a doctor. Experiencing dizziness, ask a doctor. Need advice on new medication? How to break the news to loved ones? The best way to remove bullets from a body, from a memory? Ask a doctor. Living with the thought that you missed something? Ask a doctor. New ways to cope with PTSD? How to balance life whilst working a 60-hour week? How to survive a 60-hour week? Tips for saving money while paying student debts? For ways to ruin your friendships, neglect your partner, disappoint your parents, forget birthdays, catch-ups, isolate yourself. If you're stressed about your discipline choice, career choice, every life choice, thoughts of burnout, despair, thoughts of hopelessness, thoughts of ending it all. Ask a doctor how they're feeling, to open up, what needs to change so we can break the stigma. Ask a doctor.
Thanks for having us, everybody. Thanks, everybody. So I'm Claire, I'm the CEO at the Havas Lynx Group. Joining me on the panel today, we've got Dr. Freddie Lewis, who's a senior medical advisor at the Havas Lynx Group, and absolutely thrilled as well to be joined by Dr. Carys Royles, who's a practicing physician within the NHS, and he's going to give us a bit of an insight into what it's actually like being a doctor in today's healthcare system. And what we're going to talk about for the next kind of 15, 20 minutes, as the film kind of touched on, is really the mental health and well-being of HCPs around the world today. And this topic really came to us and came into view with us as we were launching a new data offering recently called Point One. It's very comprehensive, flexible piece of data which gives us both a psychographic view but also channels and media information around physicians outside the US. And as we were crunching into this data, it really became apparent to us that there was a burnout problem within the healthcare system at a global level. We were seeing from our data that HCPs are experiencing almost 25% more negative emotions on a weekly basis compared to the general population. And this was a trend that was borderless. You know, we were seeing the same data in China, in Japan, in Brazil, as we were across the rest of Europe. And it was also a trend that we were seeing across all types of specialties. So it was equally as true whether we were talking to oncologists, neurologists, dermatologists, and it was across every single level within the healthcare system as well. And in fact, actually, millennial doctors are finding it harder to cope than the boomer counterparts. And so this is impacting our physicians and our doctors on a daily basis. We were seeing from a lot of the data that almost a third of physicians were experiencing almost moderate to extreme fear in the work setting on a daily basis. So it's really, really quite provocative and staggering when you start to think about it. So just to get us open, maybe we could start thinking about what are the drivers, what are the causes behind burnout, and maybe Freddie, you can kick us off.
Yeah, so I'll aim to give a few data points, and then Carys is going to helpfully tell us what that might mean for people, the human feelings for that on the front line. So when we were interrogating our unique data set, it showed us really strongly that 70% of HCPs are reporting increased workload is putting them under increasing pressure every single day. And Carys, could you tell us a little bit, give us a flavour of what that really feels like?
Yeah, absolutely. I mean, it's just a tsunami of need, really, is what's driving it. There's no control over what comes through the door. You can never say, no, this is enough now, I've got enough on my plate. So it's just the volume is relentless, and the complexity that we are looking at in 2023. There's never, one problem. There's never a singular issue that you can easily solve. Patients have multiple diseases. They're living with conditions that interact. They're on multiple medications. So it's just not compatible with a number of people who are trying to do the work, really.
And another really interesting data point was that 40% of HCPs say that a culture or adverse media has increased their level of pressure to extreme stress levels. And that increases to 59% in China. So we're seeing some real regional changes with that. Is that something that you've experienced as well?
Oh, absolutely. I mean, it's just basic human need, isn't it, that you need to feel as though what you're doing is worthwhile and appreciated, and there is a lot of negative press nowadays surrounding healthcare professionals, and you can be absolutely trying your best to do a good job, and then faced with a lot of criticism, which is very difficult to accept. And because of the volume of work that's coming through the door, everybody is extremely pressurized, and the environment, the sort of working relationships in the hospitals can be strained as a result of that, and it becomes difficult to continue really with the same level of enthusiasm when there's a lot of negativity surrounding the situation.
And that relationship, I think, is also key. We were seeing that 37% of HCPs are feeling lonely and like they're working alone in isolation. Staggering levels when, from a profession that we would expect would be all around multidisciplinary collaboration.
Yeah, I mean, again, it just comes down to the amount that needs to be done. We would love to be able to undertake that collaborative working, maybe pull in the right people to think about what does this patient really need from me. But so frequently, the question that you ask yourself when you've got X amount of work in front of you is, how can I just keep this shift basically safe? How can I do what this person bare minimum needs rather than what would be the best care that we could provide? And that is now not something that happens every now and again when you get a really difficult shift. It's just the norm.
And I guess there's got to be a contributing factor of cognitive burden as well. There's such a wealth of data and insights that are coming through on a almost daily basis now. It must be overwhelming to almost try and keep up with that.
It absolutely is, and I think we were chatting earlier, and there's a really interesting a piece of data about the doubling time of medical knowledge. So I think in the 50s, it would take about 50 years to double what was out there, and in 2021, I think it was more around the sort of 70 days where the medical knowledge doubling time would sit. So it is an impossibility to keep up with that, and I think the expectations have remained where they were perhaps in the 1950s, that there is this sort of all-knowing ability amongst healthcare professionals, but it's impossible in the current context.
And this obviously all comes at a cost as well. I mean, probably most heartbreakingly is the cost to the healthcare professional themselves. We're seeing levels of between 20 to 45% of healthcare professionals are feeling or are clinically depressed. I think probably the stat that stood out the most to us was that we were seeing the level of suicide within HCPs is 5 to 7 times higher than the general population. In the UK alone, there's a doctor taking their lives every 3 weeks. I mean, Carys, is this something that's visible within the healthcare system?
Oh, without a doubt. Unfortunately, within my own experience, I can recall just last summer in the northwest of England where I'm training, we received 3 emails from the deanery in 1 month to inform us that one of our colleagues had taken their life. So it's really prominent, and that's just talking about the most extreme consequence of this problem. But it's not just suicide and severe mental illness, but I would struggle to think of a single person who I've worked with in the last 10 years of my training who hasn't had some degree of impact negatively on their mental health as a direct consequence of the way in which we're being asked to work nowadays.
Absolutely. And presumably this has also got a cost to the patient as well, and patient outcomes. Freddie, I don't know if you can touch on that.
Yeah, so we know that the impacts on the quality of care and some of the aspects of care is also wide-reaching. So when you're working and operating in a stressful situation like this, we know that the prefrontal cortex loses the ability to maintain that focus, and it means that you end up with a more primitive kind of fight, flee response, and it's really difficult to make the kind of complex decision-making that we would expect from our HCPs in those situations. It also results in poor memory and really poor attention span. And it can also lead to some interesting emotional kind of preferences around being risk averse and also working in a sort of neurotic and cynical fashion. And obviously, those negative effects are borne out in the healthcare system. We know it is evidence-based that when healthcare systems are operating with those kind of stressful environments, that it is absolutely statistically proven that outcomes and patient outcomes are adversely affected. And of course, that's a tragedy in terms of a human cost, but it's also a serious issue for our industry, right? So when physicians are stressed, they cannot engage in that subtle testing for things like subtypes analysis, or maybe to explore sort of extra quality of life type elements in their patients, which we all know are crucial for the kind of therapies of the current landscape and of the future. And they also, we know that they default to kind of heuristics, so it's not around doing an in-depth analysis of the situation in front of me. They kind of use mental shortcuts, and they default to the kind of status quo decisions that they've made in the past, and they're less willing to engage in new innovative ideas or maybe take the plunge into sort of trialing a new therapy that we might be interested in telling them about. And ultimately, at the end of the day, a health system that's operating at that level lacks the resilience to really do its part in that end-to-end role, which we need from all of the therapies that we know are in the current landscape and in the future. I mean, Carys, did those kind of elements ring out in kind of your experience and your sort of...
Without question, yeah. I mean, I've been there myself. The most stark example being, you know, in the midst of what was happening during the worst peaks of the COVID pandemic. You're describing exactly what was happening to me. It was definitely burning out. There was just too much going on. Decision making was impaired. You know, what we're trained to do, what we do really well as physicians is sort of taking in a huge volume of data, synthesizing it quickly, and then making risk-benefit decisions. And that, you know, taking on a certain degree of risk is what we do, is what the job is. And when you feel this way, when you're anxious about your decision-making, when you're overburdened with the volume that's coming your way, you lose the ability to be objective about that. So you don't take calculated risks, which is part of the job. I could see myself moving away from taking the decisions at all and deferring to other people for simple things that I would have been able to do 5 years earlier in my career, and just not having that sharpness, brain fog, etc. It's absolutely hugely impactful. In impairing your ability to take those decisions and maybe think laterally about how you might want to treat this patient.
Yeah, and I think, you know, everyone in this room, ourselves included, we spend a lot of time thinking about things like patient identification, introducing new treatments, diagnosis decisions, medical education, and I think probably it's fair to say that we fail to take into account the mental health state of the HCPs we're talking to and how stretched they are in order to be able to really digest that information and be able to act and change behaviours from that as well. And I think that's probably one of the biggest drivers to what we're seeing in the mass exodus of healthcare professionals out of the healthcare system. You know, from our data, we're seeing that, you know, close to about 20% of healthcare professionals on a global scale are expecting to be leaving patient care in the near future, which might make some massive challenge as the healthcare system goes on. And it contributes to the WHO's estimate that we're going to be missing about 10 million doctors by 2030. So I guess when we talk about this, you think about the scale of this, the challenge of this, the stakeholders involved in this. You'd be forgiven for thinking that this is something that is going to be tackled by a huge amount of people, but yet there's actually a number of barriers to being able, from stopping HCPs from being able to connect with the care that they so desperately need. And I wonder, Fred, if you could talk a little bit about that.
Yeah, so in our analysis, we just boil that down to two core issues, really. There's organisational barriers, and then there's sociocultural barriers. Organisational barriers are just these systems are stretched. They don't have the capacity, the resilience to give people the space to work through some of the enormities of their daily experience. And then in terms of sociocultural, we know that stigma is alive and well in the wider world, but it's particularly so in HCPs. And the data shows, you know, of HCPs who are experiencing depression, 50% of those didn't reach out for support because they felt like it reflected negatively on them as a person. Is that something, Carys, that you've seen in your own practice and your colleagues?
Oh, without question. You know, I think doctors make the absolute worst patients, really, don't they? It's very difficult to make that statement, to ask for help. Although I think organisationally there are improvements now. The COVID pandemic drove that because they had to acknowledge that there was a lot of traumatised clinicians out there who needed that trauma-informed care and therapies. So that's improving, but where we really have a sticking point is that it's still enormously stigmatized to say, I don't think I'm making good decisions because I am not mentally firing on all cylinders. The perception is that people will judge you, that you will be considered not to be competent in the job that you're doing, when in fact the total opposite is the truth. And when you say, you know, I need to take a moment, a step back, I need to talk to somebody about this, I'm not thinking right. I'm not making clear decisions here. That's how we should be. You know, the dialogue should be there, but unfortunately, we are a way off being able to have those conversations openly with each other.
Yeah, absolutely. And I guess, I mean, this all sounds very negative and hopeless, doesn't it? But I think it's probably worth talking about things that we can do to tackle this challenge and start to reverse the trend that we're seeing from a burnout perspective. As we were pulling this piece together, you know, just a quick thought that we had that came to mind was the role of the rep in all of this. You know, there was a session earlier today that was talking about the role of the rep when it came to thinking about the patient, thinking about the product. And I wonder how much of a role the rep could be playing in terms of asking the HCP how they're doing. You know, historically that relationship's been quite one-dimensional, really. You know, can I count on you to prescribe brand X is the historic saying, and it would be interesting to see how much of this could be unlocked, but just by flipping that question into, you know, doctor, you've got a lot on your plate. How are you really doing? And almost training reps to be mental health first aiders. It would be fascinating to see if that could be a first step into providing a point of contact for these doctors and providing a way of starting the conversation. And you know, Fred, you had a couple of thoughts in this area as well.
Yeah, and I think this persona above us just dictates that. You know, I think it's about acknowledging and understanding the problem, whether it's from segmentation, persona development, but it's about understanding. You know, if we're dealing with a burnt-out oncologist, for instance, we need to take a different approach. We need to be empathetic to their cognitive burden. And the trend in data doubling isn't going anywhere, right? But we can control is the relevance, the style, the timeliness of our data and communications. And continuing with oncology, our point one data shows us that oncologists on the whole are more receptive to social type of learning environments. I would caveat that except for the people in France and Germany. For some reason, that's very low down in their preferences. But if we've got some terrific data on how we can use that and really empathize and connect with them in a way that suits them. For instance, also podcasting. We've got some intriguing data around where we can use that to maximum effect. So I think getting towards the end, Carys, any final thoughts here from the HCP perspective?
Yeah, I think we just need some sort of broad thinking about how we can try and reduce some of these burdens that contribute to what's happening here. So there's not much we can do about volume, there's not much we can do about the organisations that we work in, but can we distill the data for us in ways that are sort of available to us at a fingertip when we need it? You know, I might not be ingesting anything that's going on during, you know, a rep meeting, but 6 weeks later when it's 4 o'clock in the morning and I need to make a decision when I'm on call, I might remember that there's something relevant there. Do I have that to hand, you know? And for me, and I think a lot of my colleagues, despite lots of the sort of negative output in the press recently about AI, most of us are really excited about it. How can that work in my favour in terms of taking on some of that cognitive burden of decision making and, you know, wading through that data so that it's available to me in the moment that I need it, to better inform those sort of decisions and lower that risk profile of all of the work that I need to do on a daily basis. Really.
Yeah, I mean, that maps exactly to what we saw in the data where behind new medicines, the number one request for pharma from HCPs was artificial intelligence. And more often than not, that was in context of standardizing or simplifying decision making. So I think that makes perfect amount of sense. I think that's a nice place to draw it to an end. So, you know, I just want to say, obviously, a massive thank you to my panelists, Dr. Freddie Lewis and Dr. Carys Royles. We're going to be milling around if there are any questions. And so we've got, we do have a question straight away. I don't know if we've got time, but...
We have to make time. Quite right. We do need to make time.
We're asking doctors to make time all the time.
Absolutely,
so let's make
yeah.
a bit. So first of all, I want to tell you that I'm very touched by this session. I thought it was one of the most important ones. I want to thank Havas for taking this on.
Thank you.
Absolutely. I want to thank Clarice stepping away from your patients because, yeah, you're letting a few down by being here, but maybe you help a few thousand. So it's that. And so I have two asks. Number one, Havas and doctors, keep doing this. And number two, organizers, it's a shame to have this at the end of the meeting with so few people. This is absolutely an outrage. We talked 2 days about targeting doctors and this, and we forgot to start with the doctors. If there's one thing we've learned in the last decade is about we should start with patients when we talk about patients. We've been talking about you, Clarice, for 2 days without ever asking what you are as a whole person. And so I do agree AI can help, but we have to acknowledge that in the same way as a person with a disease is more than the pill they take, you are much more than the prescription you make. And so we need to look at you as a whole. And again, thank you. And next year, I'm not coming back if we don't start with the customer.
Thank you. Right, thank you very much. It looks like we've got a couple of questions out the back there.
Thank you. I just wanted to echo that. My son is a doctor. He's a registrar. As I was watching that video, it was making me cry because he has been suicidal. He has been overwhelmed. And he can't talk about it because he works in psychiatry. There's patient confidentiality. And when I say to him, how are you doing? He said, I'm overwhelmed. And that's why I think as an industry, we have a moral obligation not to waste doctors' time and just go with solution that really addresses their pain points.
Yeah.
Thank you.
I think to that, I mean, we were talking about this earlier actually, but the language that's used around physicians is often, you know, they're superhumans. And I think, Carys, you were talking about this earlier, but, you are just humans and we're expecting almost too much of our doctors today.
It was so exacerbated during the pandemic, and it's with such nice intention. You know, people refer to the HCPs as, you know, heroic, angelic, etc. But it is a job, and it's done by normal people who have normal lives and difficulties and a spectrum of, underlying mental robustness. And so that sort of narrative is really unhelpful because it makes us feel as though we have to live up to that reality. And in fact, most of the time, as you say, people are really struggling to just turn up and get the job done, let alone be something, superhuman.
Yeah. I would say for your son as well, as we were doing this research, we came across a few, it's not much, there's not enough out there, but a few bits of resource. So I've got a little link to it that I can give you later as well. Wonderful. All right, well, as I say, we do have links to the rest of the white paper if anyone wants to have a little bedtime reading. But other than that, thank you so much for your time and attention today.